My name is Dr. James Andry. I'm an orthopedic surgeon who specializes in shoulder and elbow reconstruction. My practice mainly focuses on both the arthroscopic treatment of the shoulder injuries as well as up to and including the replacement of the shoulder. I take care of every single problem that we are able to treat in orthopedic surgery when it comes to the shoulders. There's anything from sports medicine injuries to arthritis to complex trauma. Grew up in the San Fernando Valley in Los Angeles. After college, I went to Georgetown University School of Medicine. Spent 4 years there earning my degree, and then I did my orthopedic surgery residency at a hospital up in New York City called St. Luke's Roosevelt Hospital Center. I was fortunate enough to earn a fellowship through the American Shoulder and Elbow Society and a shoulder reconstruction fellowship. And after that, I went into practice to start my career. Originally, I was in Arizona for 8 years. My practice was a combination of both private practice as well as academics, where I was a associate professor of surgery at Creighton Medical School. I was also the chief of surgery at a multi-specialty group in Phoenix. 3 years ago, we moved out to San Diego to raise our family with my wife, who's also a physician in town. The sports medicine aspect is about 50% of my practice because of the type of problems that present themselves to me. Again, that along with the shoulder injuries, that's a lot of people who are doing overhead activities like tennis and volleyball or baseball, surfing. They're going up to the mountain for snowboarding. They're going for a run. And they will develop knee problems or twist an ankle. But, I mean, we do see, again, the activity level of San Diego and the population here, people like to get out and play. And a lot of athletes end up on the disabled list because they tweak an ankle or they twist something or they fall down, and you have that taken care of. So we do see a lot of sports-related injuries. People want to get back to the things that they love to do. We're able to help them get back to that place. The disc model coincides with everything I've been trained to take care of people, right? You take care of the entire person. Again, there's an intrinsic dignity that every patient has and deserves. If you start there, you're able to take care of them at the highest level. And disc does that. And that's why I wanted to come and work here, because they are able to support the mission that is to take care of the patients and have them have confidence in the team that they are entrusting with their health. My favorite part of my job is when the patient no longer needs to see me. When you see someone come in hurt, and then you see the process of them from the first day you meet them when they're injured, and you are able to guide them through the entire thing to where they are able to go back to the life that they had before their injury, is a fairly amazing thing to be a part of, especially when you have to go and fix them. If you have to go and take them to the operating room and take care of something for them and guide them through their rehabilitation afterwards to the point where they walk in and they're 10 times better compared to when you met them, it is a pretty awesome thing to see. Speaking as a former overhead athlete myself, the best medicine is always prevention. So for the overhead athletes, you want to make sure that you maintain normal motion and good stability and strength about your shoulder and your elbow. And this is in addition to all the techniques that you learn as an athlete and having good form and whatnot. But if you maintain the appropriate strength and the appropriate muscles with the appropriate motion, that is the best way to perform at an elite level while protecting yourself in the strongest fashion from an injury. And that will give you the best possible performance you can for the longest amount of time.